2, 1, 0, start. Please start.
Thank you very much. Thank you, everybody. Thanks, everybody, for joining us in this pandemic session, which is mainly focused for the African countries as well as international. So, we welcome all of you, all the speakers, and those who are online, those who are listening through here in a webinar, in the direct Zoom or in the YouTube. And so thank you, everybody. And all the credit goes for this technicality goes to Mr. Anindo Banerjee, who has done everything, and he is always with us and supporting for making on behalf of the Noble International University. He is a multimedia expert internationally, and he's also the one of our that is a lecturer and a professor of multimedia for and set up the online teaching program is coming very soon. He and his team are responsible for this. So thank you very much. And also I give the introduction with second with Dr. Grame, so that he will tell about himself, because he's a very high profile gentleman, high profile person, a scientist, and he will talk later. And also that Professor Guy, and also the Kwazame Grame, so all the stalwarts from Africa, so that they are here and they will share their experiences here in this discussion, international, there's a COVID-19 and the pandemic period. Now I pass to my colleague, Professor Roger Hansell.
Hello, everybody. Yes, I'd like to say a word about Dr. Ganguly. Bob is an inventor. He's famous for his anti-pollution devices, some of which are being examined for use in Africa at the present time. But at the moment, he's working on a viral control apparatus that eliminates COVID viruses from the air and from surfaces. So it can be used to clean everything from airplanes to hospitals to classrooms to our personal living areas. The concept is to attack the virus itself. It's very, very small, about 200 nanometers, and to also to knock the larger particles in which it's suspended. So it passes through the air, often associated with moist particles, which are on the order of close to a micron in some cases, and a dispersal of different sizes. So the idea is to knock those particles out of the air, get them down onto a surface, and allow the, in Bob's case, ultraviolet light time to act upon them. And this has been tested very successfully, but we still don't have the COVID-19 tests, because those are only done in very special level 4 or 5 laboratories, and there are not very many of those around. But that's the next step. And at that point, it should be available for Africa, and in fact, for anywhere in the world. So that's part of the pleasure of working with Dr. Biswajit Ganguly. So that's my comment, Bob.
Thank you very much. And also that you forget to add that is a combined technology with the special UV radiation and the plasma ion technology. That is also the invisible way that it also works for the any kind of that particulates, especially if we have tested in the laboratory. So it worked for the any kind of smoke and everything. It 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 worked successfully to that distract that all those particulates. Anyway, so we are on the way. We are trying to work on that. Is a kind of alternative technology that is apart from the vaccine. So we are working to support the whole community and the whole world, so that we need all of your strong support to work it out and to give it for the detoxification of the air inside the building and inside everything, inside the aircraft, to inside the hospital, everywhere, that will be able to make the production in a very economical, cheap price and to circulate all different countries around the world. So we need all of your support. Thank you very much. Now I introduce our Dean of Studies, Professor Dr. Mary Jo Reddy. So she is an international expert in a field, in a biology, and also that she's teaching for many years. And so I pass my microphone to her. Thank you.
Thank you very much. This is the second in our series of lectures and seminars or webinars on COVID-19. The one last month, which we invite everybody to visit on YouTube at RITAM. What's the name of that? RITAM Bangala.
RITAM Bangla is supporting.
RITAM Bangla.
RITAM Bangla is supporting.
And if you go to that website, which is the same one that this is being broadcast at, you should be able to pick up and see the one that we had last month on, which was a general introduction to COVID. I was very pleased that we decided to do the first of our specialized groups on Africa and the COVID-19 pandemic, because the continent has been hit so hard, not just by COVID, but by numerous epidemics and pandemics over the last few decades. So with that, I would like to introduce our first speaker. Our first speaker is going to be, and I'm going to apologize in advance if I get the name wrong, pronounced wrong again, but Mahmouda Gai. Dr. Gai is from Senegal, and he is he is part of the African Diplomatic Academy. He is also a researcher. He's an author. He has been part of the United Nations Development Program, and he will be speaking with us today on the impact of COVID-19 on Africa. So thank you so much. And Dr. Gai, please, I turn it over to you.
Thank you so much. It's a great pleasure for me to be with you on behalf of researchers and teachers and scholars from West Africa, West Francophone Africa. My name is Mr. Gai, Mamadou Gai. After my studies in Senegal, the first time I went for 8 years for a doctorate in economy and marine fisheries in Moscow. After USSR, I came back to Senegal, where I lived for 3 to 5 years before I went back to Montreal and Rimouski in Canada for grad studies in another area in regional development. After that, I came back in Senegal for a couple of years, and I went for a scholarship for doctoral studies, a PhD program in regional development at Chicoutimi in Canada. So after 2 major researches, I came back in Senegal, and I'm helping young students in different faculties in methodology and research. And my interest is territorial urban economics, urban development in Africa. Since 2010, the continent has been growing, and we reached almost 1 billion people since then. But we didn't have the chance to meet people like Rogers and Professor Ganguly to exchange with them on what are the major issues and what are the major solutions that we need to put in the continent to help sustain lives. We have much more politics, people in politics, and they don't care about people. They don't care about population. Like you at the Nobel Institute of Environment.
I think we may have lost the connection for a moment.
Connection problem. Hello.
These things happen with webinars, so let's give him a moment. I will take this opportunity to give a preliminary introduction to one of our other speakers. Dr. Julian Gojar is
And I met with Professor Ganguly.
Yes. Hello.
Hi. We lost you for a moment.
And
you're back.
Yes. And I am so happy to be with you and sharing with him, because I am with a friend of mine, the director of the Center for Studies in Sustainable Development in Africa, Mr. Drame. With Mr. Drame, we are launching a program to help sustain development in Africa, but we need the support of Professor Ganguly from the Nobel Institute of Environmental Peace, because we are teaching sustainable development, we are teaching environmental policy and environmental impact studies and strategies, but we don't have people like you, big specialists in peace and environment. There's a lot of possibilities that we have in the continent. In 54 countries, there are a lot of possibilities, but we need support, we need mentorship, we need people to come with us and develop research in that area. And we know that you have that with Roger Hansell. You have that. Professor Ganguly and Roger, you know that. We know that you have that thing. And what we want is, before we start any talk, to thank a lot Marijo for all the coordination, for all the follow-ups on a daily basis. She's following with us to be here today. Thank you so much.
You're more than welcome.
We thank also all the other speakers and tell them that we're not coming to teach. Yes.
Thank you very much, Professor Guy,
Yes.
for your
Yes.
great introduction about that
Yes.
is regarding that is our work and the trust of our works and activities internationally. Of course, we are always I've always with you, with Africa, and also already we have the opportunity, and also that we visited in Sudan a couple of times, so that we know the continent, the African continent, and we have many colleagues and also the students from different countries of Africa. They are with us, and always we try to support And we will definitely work with our technology, especially with the pollution control technology, as well as, so once it goes little further about the virus control apparatus, we will try to promote it in African countries also, other than,
Thank you so much.
different countries. Yes,
Thank you so much.
welcome.
After that small introduction, what I will say is that I want to lay out my speech in 3 points. One is the African history with disease breakdowns in the continent and what kind of policies that we developed to fight with them. The second thing is we need to go to the context of the pandemic in the different countries, in different regions. In the north, in Maghreb, Morocco, Egypt, Tunisia, and other places. In the west, Senegal, Ivory Coast, Burkina, and the others, Ghana. In the center, Chad and the other countries, but in the south also and the east in Kenya, because all the situations are all different. And from there, what are the perspectives right now and where we are heading to right now in the fights, in the different strategies to fight COVID-19 pandemic in the continent. To tell the truth, in the continent, since almost these last 100 years, there was a lot of, diseases that we witnessed in the country, in the continent. It started from measles, going to tuberculosis, going to different types of disease in the continent. But most of the time in the last century, what happened is there was a lot of money, a lot of funding, a lot of resources that went from international organizations, that went from big countries like the United States, like Canada, like Australia, like England, and other places to come and release and help and relieve situation in the continent. All those money, all those resources that they mobilize and bring it in never served the poor people. It went to bureaucracy and it went to governments only. 90% of all spendings went on nice cars, big offices, a lot of traveling in different planes in different countries, hotel accommodations, and leisure, but not supporting social issues in the country. Africa is the continent where you have right now 3 or 4 presidents that are almost 30 to 40 years in power. That's just in Africa that you have that. You have one in Cameroon, you have one in Congo, you have one in other places. People are in power and they like power and they don't do any development. They don't do any social development for the population. So for the last century, there was a lot of funding, there was a lot of support, but it never went to population. When it comes to COVID-19, COVID-19 started in March 2020, in March. And all of the countries, they went and started talking about strategies, common strategies to fight COVID-19. But they gathered the money from donors, they gathered the money from big countries, they gathered money from WHO and everyone. But still, right now, 1% of the population in Africa didn't get their tests, didn't get also their vaccines. Just 2-3 weeks ago, India brought in a lot of vaccine, AstraZeneca, from COVAX initiative. But the thing is that they say that this is some vaccine that will be used for elder people in the countries, but they never did it. They use it for politics. They use it in their own parties for themselves. and people didn't get vaccines right now in Africa, in most countries. In Senegal, out of 15 million and a half, 300,000 people didn't get the vaccine yet. And they just got their first shot. We are waiting for the second shot and the third shot. If you're talking about 300,000 people out of 16 million, it's nothing. And what is happening in Senegal is the same in other 53 countries. But the situation is different depending on the geographic locations. If you go to North Africa, Morocco, Egypt, Tunisia, and other places, they're closer to Europe, so they can get vaccines easier than other people. Further, if you go down, you'll see South Africa, and South Africa got the money and the resources to go and buy the vaccines. But all the middle, you have sub-Saharan Africa, people don't have the money to go and buy their vaccines at the right time. So the situation of COVID-19 is the same as it started in March. It's a little bit of strategy that they're working on, is to work with schools, to work with some small communities on hand washing, on wearing masks, and being distant from one another, 1 meter or something. That's it. But using AstraZeneca, using Sinopharm vaccines, there is a little bit of population that have the chance to get to that. So when it broke down, the last variant broke down in India, people were really fearing, not in India, but they were fearing in Africa, but they were saying they want to have vaccines because India is coming with vaccine to help us. And there's a big breakdown over there. There's a big problem in India, so they won't bring us AstraZeneca this time around. From now on, we are happy to hear that Professor Ganguly and other people like him are trying to find some new ways of fighting COVID-19 in the continent. There is a need to go and investigate country by country in sub-Saharan Africa the realities, because culture is different, and the big impediment in this fight, in this strategy, is culture, because people live in communities and they really close each other. Parents, friends, buddies, and everybody, they're giving hands on a daily basis. So COVID-19 is moving around very fast from any other corner to the other. And people are dying. People are not giving the right information, they're not giving the right data. Even population don't have the right information right now. So there's a lot of people are talking about strategies, but I think it's just politics. There is not. If India asks what's the current right now, if you have any other questions or any other elements that you want to talk with me, to do that, because many African countries have been praised these last days for waging an effective campaign to combat the spread of coronavirus, despite their reputation of having fragile state health systems. Everybody is praising Africa. It's not true. The country has 1 million cases. And in the 1 million cases, people don't know even how many people died and how many people survived. The right information is not there because there is no statistical studies, right studies in different countries. People are saying that our figures are lower than those in Europe, in Asia, and America. It might be true, but it's declining. Okay, cases are declining, but how many people are dying, we don't know. So when people are saying that in Africa right now we have 37,000 deaths, I think that is not true. It's more than that. It's not 30,000, 37,000. Because they want to compare our figures with the American figures, 580,000, to the European figures, 230,000, and to Asia, 205,000. But the thing is, our figures can be lower, but how many people were tested? Because there is not enough testing kits for African people. So how many people were tested out of this billion people that we have? This is the question. So the low testing rates continue to undermine the continental response. That's the truth. There's no indication that a larger number of COVID-19 deaths have been missed, because there is no statistics about it. So it may be some reasons that we can see. There was a quick action in March, even people were running all over in Senegal and other places. There was a quick action, that's true, but it doesn't mean that we are in low rates right now. Compared to other countries, I think the response is more serious because there is public support. In Africa, there is less public support. Less countries also have developed adherence to COVID-19 measures, washing hands, avoiding places of worship, mosques and churches, reducing shopping trips, avoiding handshakes, which is a big problem because in Africa people like handshaking and like public gatherings. Less people are wearing masks, and less people are staying home because they like outings. So there's a lot of risk in the continent. The young populations, mostly 50 to 60% of the whole continent is young people, and this is a very big problem because most of those young people, they don't listen when you're talking to them. People age of 78, 70, 60 and up, they are more responsible, but young people in schools, they don't even follow, the measures. That's why the COVID-19 pandemic has largely been in younger age groups than in elder ones. 91% of COVID-19 infection in sub-Saharan Africa are among people below 60 years of old. This is the truth. And in Africa, the old people is not too much. Age 65 and up is almost 3% of the population. So we are exposed, the young people are exposed in the country. This is the situation. The underdevelopment of transport systems bring people in gatherings in different countries. And this is a big problem in Africa right now, the public transportation system, because that's not everybody that can buy himself a car. Some specialists in Maryland in the United States found that there is a big correlation, statistical correlation between temperature, humidity, and the spread of COVID-19. But the thing is that different conditions of living, different conditions of standards of living in the continent are explaining the difference in, COVID-19 fights or initiatives to fight them. So sub-Saharan Africa is the most exposed part of the continent. There is no good community health system, and there is a lot of problems with health systems in terms of action, in terms of health, human resources, especially some skilled people, in terms of resources, in terms of financial resources. There's a lot of constraints right now relaxing in Africa. No, they're trying their best. They are not relaxing. They're trying to fight against this pandemic. They're going from school to school, from gathering to gathering, talking to people. But still the situation is there, and the situation is really risky. The situation is really bad. Thank you so much.
Thank you very much, Professor Guy, for the information. So what we understand, so that we are very upset about the situation of Africa. So if any way that we can help on behalf of our noble institution or the Noble International University, if we will very happy to help and support, including that if we can also that to make develop the special technology there in order to at least for the basic support for the pandemic, this thing for the COVID-19. So I want to tell Professor Hansell, Roger, so if you can add so how we can with the machine that that we develop. So if we can do something and to give the support and also the some kind of moral support and a kind of leadership is very important there. So whatever that my understanding. Roger, do you want to say something?
I think really it depends upon the African initiatives at this point. You have the technology which can be provided, and the question is, where can it be most usefully employed? As you pointed out earlier, it can be used in airplanes or buses or cars or homes or hospitals. The real thing is to get the final testing and financial pieces.
Yes, so I am thinking that also to develop in another kind of model with that. So it has to be a kind of portable model that everybody they can carry it with them. It should be the battery operated technology that I can work on that, and to give the people they can carry it and they can where they are there they can use it on the table or any place apart from that. So that we can talk and discuss and we can write something and on this kind of technology, and we can support, and even that we can also economically we can manufacture in India because we have our production unit and the factory set up in India, in Calcutta. So that is possible. In future, we can talk on that, and because I know that Professor Gaye has a good connection with the Prime Minister there, right, the head of the country, also with the African Diplomatic Academy, right, and so that it will be wonderful. So we need the strong support of Professor Gaye on this regard.
Yes, I think that if your invention is already patented and is already working, I think that you should write up a small, flyer on it with the description of everything, so we can go and introduce it to the Ministry of Health and the government and see where are the right places, like Roger said, where we're going to use it, because it might be used maybe in public transportation, in schools, in gatherings, in mosques or in churches, in places where you have a lot of people. I think that those are the places that we need to find out and to go and test it and show it.
Yes. Okay, so thank you very much. So we will keep in touch. Now we want to introduce the one distinguished professor, the UNESCO laureate, Professor Basiru. He is now in Nigeria. Professor Basiru, hello.
Hello.
Hello, can you come in front?
Hello, hello. I'm coming. I'm coming.
Yes. Okay.
I'm coming.
Okay.
I'm coming.
Okay.
Just a minute. I'm coming.
Okay. Your camera, yes. Thank you very much for joining us. That Professor Basiru, he is the UNESCO laureate and international expert in his field, and he worked all over the world. And he is also a vice chancellor of the Crown International University. It is in several countries. So Merijo, so that we can and we are giving him there's a guest of honor. Merijo, you want to
Absolutely.
say? Yes.
I just wanted to say that I can't begin to list the accomplishments of this man. His biography just goes on and on. He is the Vice Chancellor of Crown University, a UNESCO laureate. He is a distinguished professor at one of the founders, I believe, of Crown University, which is in several countries. And what impressed me personally as an American the most was his incredible dedication to the African diaspora. So, and with that, I would like to introduce Professor Basiru as our keynote speaker.
You're welcome. You're welcome. Okay. You're welcome. So I just want to talk brief about the pandemic, as what is happening in my own country in Africa. I will have to talk just to brief you because of my predecessor in this as a keynote, one of his keynote speaker. I already spoke something that relevant to it. Likewise, me also, I want to make my own quota contribution for the race. So I'll just go brief for what I've prepared. The novel of coronavirus pandemic shaped our generation of this 21st century, just like the replica of the Second World War shaped the early generation. Play the partnership with the stakeholder on research and development toward the end of the COVID-19 pandemic, especially in Africa and some parts of the world, to tackle this particular disease. So COVID-19 is like a Second World War for the current developments in our society, which is pandemic will describe our future, our present generation and our future generation as well. That is why I set up my own foundation, that Professor Aremu International Foundation. We committed to partner with the stakeholder toward the research, development on end the COVID-19 pandemic. Also, the group also working to make sure that these are partners who battle this disease, just like we have partnered with so many government and non-government organizations, just like Charter International Danfish University, Wayne Coast University International United States of America, Chandraka University of Kingdom of Cambodia and Asia, and International Biography Center, Cambridge in England and Europe. So my international foundation partner with some other organizations, such as Charter World Order of Knights of Justice or Peace, that is a worldwide organization, as well as International Charter World Learning Society, African International Charter, African International Institute for Training and Research, and the Charter World Institute of Book, even Bahara University in India, and other international center for higher research. So why? Because the foundation advised that regular influence is the direction by focus on technology innovation, by necessary to bring this virus to the head through the other partner, to make sure that all of us go to the lab and also work on it, how to make sure that this thing become the thing of history in our society. So it will be not be a fast or easy process. It is impossible to overstate the pain that people are to feel now, and we continue to feel it for years to come. That's the truth. That's the bitter truth, my brothers and sisters. That is the bitter truth, ladies and gentlemen. So the social distance measure and now around the world save the million of lives and not be only overreaction. So we have to point out that government mandate lockdown in some part of the world. People are properly have to change their own behavior anyway to for the infection so that we not continue to spread this particular virus. So I noted that even as restrictions were issued, many people will not immediately resume their own routine on their first day. It's so that in coming months, the drop of new infection will not be restriction in the place that social distance has slashed the rate of transmission. So it will be impossible to return to the normal state. That's the true picture of everything. To control the virus in this long term without advancing text, contact the trace of treatment and vaccine as well. Thus echoing the view of public health officials and epidemiologists around the world. So my international foundation is leveraged in fund and influence the accelerate research and develop with partner with so many other organizations and companies to make sure that this particular disease comes to the end. The dozen of the new tests are coming in market, include the rapid diagnostic tests that are working like a home pregnancy test. So home test is the best approach to detect and control the new infection. So my international foundation have been pursue approval of self-swab that will be analysis in central lab, just like Amazon recently announced the plan to build its own test lab to the screen employee. Thank you for listening.
Thank you.
Yeah.
Thank you very
Thank you.
much. Any questions or comments from either from our YouTube audience or from our participants?
Can you give us a sense of how the COVID problem is being met across the African states that you are familiar with?
When recently now, there are some of the challenge of the COVID in some part of the Nigeria and Ghana and South Africa. We are although first restriction that we are indoor for so many years. So just like the one that happened in India now, there are some part, not all of the part of India they are affected with COVID-19. So that they make them to live easy lockdown. The same thing also applies in Africa. Now in Nigeria, gradually with the restriction and instruction for the federal government of Nigeria, they have also give us instruction what to do. Just like a face mask, just to wash your hand and so many other things to make sure that the disease will not continue. But notwithstanding, we still have so many serious challenges in some parts of Nigeria. Like in Nigeria, in Ghana, South Africa, and some parts of the world. It's not totally eradicated. We still also have to battle it. Although recently we learned that the federal government of Nigeria also imported some of the vaccine to make sure that when this COVID-19 become the thing of that history, in which our president is the first person to also take this vaccine as a leader. The same to also apply to his vice, that Professor Yemi Osibajo. Also take the vaccine of COVID-19 vaccine to make sure that to protect him against this particular pandemic. So whereas all of these vaccines has not circulated all Nigeria. Not everybody are available to receive this vaccine. Vaccine is not available in all of the supermarkets or even something like this. The government also lack of the manpower to make sure that this thing is true to everyone. It's very difficult. And this particular vaccine that imported to Nigeria, some people are
Thank you.
complaining about the reaction when they take the vaccine because of we don't know, maybe because they are not familiar with the drug or what. I can't say. So that is it. So we still
Sorry, your transmission is very bad. Sorry for that.
I think we've lost the connection. I assume he
We
will
lost the
sign back in
connection.
a moment.
Mhm.
This is a problem for international webinars these days. So hopefully they'll be back.
Mhm.
So, I'll give him a moment to see if he signs back in. In the meantime, I would like to do a quick introduction of Mr. Abraham Sanish. Am I pronouncing that correctly? Sanish? And he is a representative of Noble International University in, or the National Institute for Environmental Peace, excuse me, in Geneva, and was with the UN offices here. So, and also Dr. Julian Goger. I will, third time will be a charm for introducing you, Dr. Goger.
Yeah. Professor Basiru, so that we saw, but you can speak now. Hello. There's a problem, very much problem.
Nope, we've lost him again.
We lost again.
Okay. So as a pre-introduction for Dr. Goger, so we don't have a lot of dead air time, Dr. Goger is a physician and a psychiatrist. He is with Doctors Without Borders, and he is also a doctor of law and a forensic psychiatrist. So I am looking forward to his presentation, and he will be probably our last speaker today. Our next presentation, we're hoping, for those of you who may have come in a little late, is we're hoping to look at next month the Indian subcontinent because of the ongoing disaster that's happening there right now with COVID and and the incredible wave that's running through the country. So we'll through India, and I'm assuming the surrounding countries as well. So should we wait for our keynote speaker, or shall we move on?
So we can wait for another 5 minutes. By this time, we can discuss in general with our existing speakers, with us, all of us, right? We can discuss in general about that.
Good. Roundtable time. Okay.
So Roger, you want to say something? Hello.
I have still a following up question on the situation across Africa. So it sounds as if it could be as bad as India in some cases. And so I wonder if anyone is on the air at the moment who can comment, maybe Senegal or one of the other countries.
Yeah, actually that Professor Basiru, he is now in Nigeria. Professor Basiru, hello. Hello. He came back. Hello. Professor Basiru. Hello. Because there's, hello.
Internet connection is bad in.
Very bad connection there. Now we can totally understand the situation there, right? So there's a very bad connection, even the internet, not very slow. Yeah. So that, yeah, Roger, what is your question, Roger? Can you repeat, please?
Yes. Are the other countries in Africa facing the same kind of runaway problem that India has, where the hospitals are not equal to the demands upon them?
It's a good question. Yeah. So who can give the answer?
Hello, Professor Ganguly.
Yes.
Professor Rogers, yes. The situation in Africa is kind of difficult because in some places you have access to health systems and hospitals. But in some places you are far away, 200 kilometers away, 200 miles away from a small hospital, and there is no health HR, or health, equipment to serve the communities. So the situation in Africa is atypical. We cannot compare it to any other cases in India or in Brazil or any other places because there is lack of health systems in different countries. And in some places, in urban areas, let's say Dakar, let's say Abidjan, let's say Accra, let's say Lagos, you can access to big hospitals. But if you go out of those places, you won't have big hospitals. You won't have even health system to relieve the populations. This is the situation.
Okay, thank you.
Sorry?
Yeah. And Professor Basiru is here. Professor Basiru, can you just tell about the situation of Nigeria and just
Okay, the situation in Nigeria now, they are easing the lockdown. Everybody,
we cannot. Maybe if you can disconnect your camera, the sound will be audible. Disconnect the camera, maybe we cannot hear. Hello.
Yes, Professor, you're coming through as musical notes.
Musical notes, yes, that's true.
It is, it's musical notes.
Hello.
Internet connection in Africa very bad.
Yes, very bad.
small individual working place and the business has commenced, but not condition that someone has obey the COVID-19 instruction. Just like you have to some particulars before.
Okay, so anyway, so that yeah. Okay, so maybe in future, so if you can kindly send us a note, for the situation of Nigeria and the whole Africa, so we can publish at our journal's review of the Journal of Environmental People's
Okay,
Review.
okay. I will do that later. I will do that later. I will do that later.
That will be wonderful. Wonderful.
Yes,
and
I will send it to your email later. I'll work on it and
Yeah.
send it to you. Yeah.
Thank you very much. And also, Professor Guy, if you can kindly do that, so that would be great. We love to publish in our record is the International Scholarly Journal and the review. So
Okay.
which is
Thank you so
established
much.
at the University
That's
of
good.
Toronto,
You'll have a paper
University
on
of
it,
Toronto
a small paper.
Library, and consist of the 5 Nobel Prize winner, including the
Okay.
10 international scholars. Now it is under the umbrella of our Nobel International University. So that will be excellent. If you can kindly send all the speakers and all the notes and the write up. So we are going to publish. We'll publish as soon as possible.
It's
Thank
all
you
right.
so much. We will.
Thank you very much.
Thank you.
Thank you very
Thank
much.
you very much, Professor Basiru, to be here and for your comments and the lectures. So we are very happy to know, and we
You are
will
welcome.
definitely do our best to support African continent and all the countries. In future, we need support. We need support. We need the basic funding to proceed on that, to make the economical technology to
Yeah.
promote in
Yes.
Africa, because Africa needs very much badly that what we understand. Also the other many countries. So this is
Yes.
very, very important, and we need your strong support, as you are the stalwarts and are directly connecting with the government, so that it will be easy for us to work
Okay.
if we get your support.
Okay. No problem.
Okay. Thank you very much. So
Yeah,
now,
anyway,
Professor,
hello, I would like individuals to also drop their email and phone number, especially
Wonderful.
our WhatsApp number. Yeah.
Wonderful. Wonderful.
Yeah.
Wonderful.
So
Thank
share
you
my
very
phone
much.
number and email number to other professor. What's the name of the professor? Mahmoud Ga and
Yes,
some other
sure.
one.
Yeah.
Yes.
So let me have his WhatsApp
Professor
number
Guy,
and phone
yeah.
number.
Once I get your numbers, I'll write you a message. Basiru.
So
Yes.
yeah. Let me send
Once
my
I
number
get
on chat.
information, I'll send you an email.
Yes. Let me send you on chat now. I will chat it to you now. Everybody will have my own number.
Thank you so much.
Yeah. This is the right way to work together. It's a kind of teamwork. No one person can save the planet. We need support. We need everybody's support all over the world. Maybe our Nobel institution can give the kind of leadership. We could be as a leadership to support, not to work as a kind of. We don't want a political leadership. We like the leadership of to support the public, to support the people, to support to save our mother earth. This is the most important, right, for this planet. So thank you very much. So for for this to everybody. Now I pass to Professor Mary Jo Reddy. So for the introduction, give the introduction of the one of the stalwart and the eminent speaker and scientist and
Well,
versatile genius.
Well, hold on.
Okay.
We have one more speaker before we get to Dr. Gojer, I believe, which would be I'd like to ask a few words from I'm not sure if it Dr. or Mr. Abraham Sanyet Sanyish, who is the NIEP representative to the United Nations.
Okay. Hello, Abraham. Hello.
Hello, my friend. I've dropped my WhatsApp number and phone number, so you can see it on the chat. So we will likewise I'm expect from other professors as well. So we have to do that.
Okay. Hello. Hi.
Yeah, no worry.
Yeah. So maybe he is.
Maybe he's having some connection problems too.
Some connection problems. So we can go to Professor Gojer, Professor Dr. Julian Gojer, to give the presentation, and when they come. So Mary, you already gave the small introduction. So also that I can add. So he's not only a medical doctor, a psychiatrist, or a that is a lawyer also, but he is also the very much holistic person. He also teaches the yoga meditation, and he does a lot of good. And he is also a commercial pilot. He can fly. So he has a lot of interaction. And we are colleagues and friends for a long time. So now we pass to Mary. You want to say something on Professor Gojer?
Okay. No, I think it's all been said, and we're ready to introduce Dr. Gojer. And I believe I've enabled the screen for him, so I know he has a PowerPoint. So,
Do you want me to go ahead, Mary Jo?
go right ahead.
Yes.
Before you do, though, could you please put one of your speakers on mute or microphones on mute?
I will.
Thank you.
Okay, can you see? Just 1 second. I got this.
Same problem, Julian. Go, Prof. Okay.
Do you see the PowerPoint, Mary Jo?
Yes, I do.
Okay. I'd like to thank everybody from NIU for inviting me, and I'd like to thank everybody for being present. And without much ado, I'm just going to jump right into the presentation. This presentation is a distillation of information prepared by Mr. Alex Korobov, a cognitive neuroscientist working with me, Mr. Sajivan Athavan, a psychologist, and Ms. Marcella Rincon, a lawyer. We wanted to focus more on a global aspect of mental health, and I just want to say that on global mental health, and we want to talk about how it might impact on the African issues with respect to managing COVID. Now, this presentation is not funded by anybody, and there are no conflicts of interest. I want to just point out that the World Health Organization recently has summarized a lot about COVID, noting that about 60% of disruption to mental health services for vulnerable people, and some studies have shown that the effects of COVID are far-reaching, not just for the individual, but for groups, organizations, and people in general. How can we distill all this information down into something that's easily understood? We can understand mental health as impacting at the individual level. That's the person himself or herself. And what about the family or the group or the community, the nation, and the world as a whole? I'd like to talk a little bit about COVID paranoia, how people are paranoid about acquiring the COVID virus. They isolate themselves from other people. And yes, we want to socially distance ourselves, but we also have to be careful that we don't create a COVID stigma, that if somebody has had COVID, we don't unnecessarily avoid them and deal with them in an appropriate manner. We also don't want to get into nation blaming, which we hear from time to time. I've even heard about people criticizing the WHO, the organization responsible for health across the world. We also want to be careful about these conspiracy theories that there is no virus. We want to get beyond the denial that COVID exists. We also want to get beyond the minimization of the COVID problem. And these paranoid ideas or these views about COVID have a negative effect on how we manage our mental health, from overreacting to underreacting. We want to worry about vaxxers, people who want to be vaccinated, and the people who do not want to be vaccinated. And that, to me, is also a mental health problem, because it directly impacts on how we contain and manage this virus. What about the maskers and the anti-maskers? Coming down to the individual level, the most common symptom that's been reported across the world is general fear and anxiety. What if I get the virus? Will I survive? How do I deal with it? And that generates a certain degree of social avoidance in itself. We then have reactions to social distancing. How far do we isolate ourselves? Do we keep ourselves isolated to the extent that we break down psychologically without human contact? How do the attitudes, which is a mental health phenomenon, among young people versus the attitudes of the old people? The young people see themselves as being deprived of opportunity to socialize and their recreation. The old people are worried about a few more years of life to live being deprived from them. And so sometimes there is a criticism by the old about the young and the young about the old. How do we deal with that? We then want to look at the economic considerations that impact on mental health versus people losing their jobs. And that triggers off poverty, difficulty coping, which indirectly affects one's mental health. In fact, some of the research has shown that people are more concerned about lack of food than acquiring the virus. So how do we balance off this health consciousness and our economic well-being? What about the indirect psychiatric effects of the virus? The decreased contact with loved ones, reactions to the loss of loved ones, grief, bereavement, and not even being present when the body is being buried or cremated. Anger towards governmental agencies, how do we deal with that? How do you deal with the disruption in your family life when a family member has to go to work and maybe bringing the virus back home? What about parents having to stay home and babysit their children because the children can't go to school? How does it impact on the education of your children? How does it impact on the loss of the socialization of your child, where they're deprived a whole year of education by staying at home? One of the interesting aspects is, and that I've talked to some of my colleagues, especially some of my family lawyer friends, is increased divorce rates, increased gender-based violence with husbands and wives now getting at each other because of tension at home. Relatives who have COVID and can see their loved ones, we're talking about burials and cremations with no access to even the funeral process. What's the effect on seniors in homes? We had a good story of this very wealthy man who actually purchased the entire floor of a long-term care facility just for himself. And he had all the luxuries on that one floor. So he isolated himself from all the residents in the nursing home. What he didn't realize, that the healthcare workers that he hired actually brought the virus into his apartment, and he died of COVID, whereas all the other residents who were not isolated survived. What a paradox, what a paradox, a very wealthy man. We don't think sometimes what's the effect of the COVID virus on our psychiatric patients within the hospital system. We've now shifted to having interviews with our patients by telephone. There's virtual contact with them and no physical contact, no face-to-face contact. And the quality of the assessments have dropped. There's difficulty discharging patients where nursing homes, group homes do not want to take patients for fear of another person bringing the virus into the group home. What about patients who are already locked up as involuntary patients on a psychiatric unit? They've lost their privileges. They can't even leave and go on the hospital grounds. I recall one of my patients wandering across the road to a mall. And when he came back, they discovered that he had visited the mall, and off he goes back into quarantine for 2 weeks. So you're on a secure unit, and within the secure unit, you're also quarantined for 2 weeks. What about all the programs that we had to shut down? The drug rehabilitation programs. It's all gone online, and the access to some of these programs, even in a Western society like ours, is limited. We also forget about the homeless mentally ill person wandering the streets, less treatment, spreading the COVID virus just because there's nobody to care for them. What about the impoverished mentally ill person? They both go hand in hand. We also have to look at some of our psychiatric patients in the jails, patients who do not know and cannot handle the precautions that we put into place. And with some of the jails having the COVID virus rampant, the mentally ill offender is on the receiving end. What about the effects of the virus itself and the psychiatric symptoms that it may cause? Dr. Paul Harrison from the United States in a study recently indicated that 35% of individuals with COVID-19 have had neurological impairment with associated mental health sequelae. So it's not just the indirect effects, it's the effects of the virus on the brain itself. We also forget about healthcare workers and their families, the loss of opportunity to travel safely to work, traveling in public transportation, being exposed to the virus when you get to work, loss of opportunity of working in multiple sites. We have many of our personal support workers who've been told you can only work in one location for fear of spreading the virus to the other location. There you have a loss of income. What about the fears of contracting the virus as a healthcare professional in spite of receiving the vaccine? What about how shifts have changed and how your job is done? I was talking to one of my pulmonary specialists. He said, doctor, it's so hot out here and I have to wear this protective equipment with gowns and masks, and I'm sweating. And the next minute I have to go into the intensive care unit that is freezing. It's air conditioned. And so the sweat that's dripping down my back is now freezing. And I'm alternating between the extremely hot environment on the outside and the cold environment and in the inside. And I'm afraid of getting pneumonia myself. What about the effect of healthcare workers seeing patients die in large numbers and the burnout that's caused? We often forget that burnout is a psychiatric problem itself. What is the effect of COVID on a national level or on a continent? The unique effects of the virus in a particular country has to be understood. The national policies in managing health and welfare in that country has to be understood. The country's economic capacity, the access to medical services and supplies, affordability of vaccines, quarantine of individuals from specific countries, as we see now, how countries are even barring people from some countries from entering their country. How do we look at urban versus rural disparity? What about access to the internet, telephone, telehealth, and broadcasting via television and radio? Is there a genetic susceptibility to the virus in different countries? And as pointed out by previous presenters, there's an age distribution within countries. A lot of individuals in African countries are younger. There are a lot of people in India also, where the age range is different from that of the West. I wanted to talk about a few studies. One study I read was done by the Center for Disease Control in the United States last year that showed that the number of overdoses since the pandemic have increased exponentially, most of them related to opioid overdoses. In China, Tian has shown that up to 70% of the population of China have increased levels of anxiety. Mia et al. In Latin America have shown that youth and adolescents are having considerably higher anxiety and depression. Turning to Dr. Jose Miguel Uribe, a consultant psychiatrist with the World Bank, emphasized the need to make services available to the disadvantaged youth in South America. The World Health Organization has specifically asked countries to look at mental health as a priority when distributing funding. And it is known that while 2% of most national health budgets are allocated for mental health, which itself is not enough, in reality, the funding that's received for most mental health issues, especially with respect to COVID, drops even below 1% of the total funding. How does Africa fit into this? I'm not an African, yet I'm very exquisitely aware of the benefits that we have in some of the Western nations, the problems we have in developing nations like India and Africa. But what about Africa? We can easily see the disparity in economic capacity from one nation to the other in Africa itself. We can see differences, as pointed out by the previous speakers, in the urban versus the rural effects. What about resources being available in urban and rural areas? And lastly, the age distribution. Interesting studies from Africa already, from Tunisia. High levels of distress in women in Tunisia and high levels of violence or gender-related violence in women in Tunisia. And it's not very different from other countries too. Durizo et al. In 2021, that's this year, showed in a study comparing urban poor populations in both Accra and in Johannesburg that the emotional health impacted on by the economic deprivation and the severe impact of men and women losing jobs is having a detrimental effect psychologically on all adults and children, much more than the effects of the virus itself. It's the economic loss. How does one then balance managing the virus and the economic fallout? Seymour and Friesa in 2020 did a sub-Saharan study and showed a wide disparity between urban and rural and different African nations. And an example that they give is the internet gap usage, where there's 6.3% of people in Chad having access to the internet, as compared to 87% of the population in Kenya. So how do you even reach these people? Mulenda, in a study in Zambia, showed high levels of anxiety and depression in a university population because of the impact of the virus on their education. Another UN Developmental Program study in Botswana showed that there's a significant proportion of individuals with disabilities in the country living below the poverty line. With the advent of the COVID virus, there was a sharp increase in gender-related violence, and the children form the largest proportion of the population and females who were affected by the unemployment of their fathers or their spouses, and the serious implication of access to health for even HIV patients in Botswana was a secondary effect of the COVID virus in that country. What does one do when these people who are living well below the poverty line before the virus, have these people just disappeared from the face of the earth so that we don't even know what their plight is? That's something that we have to ask questions about. Ishwarang, again this year, said that in the University of Botswana, both students and staff had limited access to internet once they're off campus. Again, telling you that if university students had such limited access, what about the general population? Summarizing, we may not know the fullest extent of the problem in Africa, but we know the problems that we have in the West. Even in Canada, when we have a difficulty in getting the vaccine for all our people, how much more difficult would it be in a country other than a Western nation, which is economically well managed? How would a third world country or a developing country manage? There is an urgent need to identify and quantify the mental health needs by examining again the urban versus rural populations, the economic classes, individual countries, as opposed to the continent as a whole. How does one create access to mental health services, access to internet and telephone services, and how does one identify and allocate the aid and resources to each separate component within the African nation? Addressing the indirect effects of the virus, that is unemployment, impact on education, and not to forget the gender-based violence. This was meant to be a very short talk, and I've taken much longer than I expected. We are all in this together, and the solution is not focusing on just one person, one community, or one nation, but on this one world that we live in. I wanted to say, so many are unable to live in dignity. The sad thing is they're not even able to die with dignity, especially when you look at this picture. Can you see the tears on the faces, on the eyes of these people? Are their loved ones dying with dignity? They weren't living in dignity. So what I wanted to say as I capture and finish up this talk is that we as human beings see ourselves as intelligent forms of life. We try to support each other, but we are dealing with a virus. And does this virus have an intelligence? Yes or no? It's merely an RNA particle, but this RNA particle has learned to survive in animals. Whether it's made its way to human beings, we don't know how it came, but this virus is destroying people, and the virus will destroy itself if it destroys human beings. So is this virus mutating to become more contagious but less virulent so that it remains in us for a long period of time? So who's outsmarting who? Are we as a human existence being destroyed by a simple viral particle, or do we have to put our heads together? It looks like the virus has put its head together, and unless we act on a global manner, we're going to find it difficult to deal with an intelligent virus. And that's the end of my presentation. Thank you.
In terms of international support, Doctors Without Borders is asking for help.
Yes, and the question being?
So the International Red Cross and Red Crescent provide blood support, for instance, in countries. So I suppose each of us from the West could support these organizations that are doing international work. Is there an equivalent for the mental illness aspect?
See, one of my experiences, Professor Hansell, is that mental health has always been the poor country cousin for medicine. And we're right on the bottom of the totem pole. We don't give it enough of importance. And I pointed out through the funding that's given, the last thing that people consider is mental health well-being. And that's often the case because people are looking at your survival. And when survival is there, you are just asking, will I have food to eat? Will I have survive tomorrow? And when I'm talking to people in India, they're asking me, we don't even have oxygen to breathe. And I hear about people giving dying patients' relatives counseling because they just don't have oxygen. So the counseling is to assist them in seeing and coping with the death of a loved one in front of their eyes. It's unfortunate that mental health receives such little attention as much as it should. So I don't know the answer to your question, but it's about people creating priorities. And it's the same argument that we have back home here. How do you balance the economic needs and keep shops open so that people can survive and have their jobs versus having lockdowns and preventing people from going out and socializing? Talking to one poor person that I communicated with in India, he said, "Doctor, I don't care about getting the virus. I don't have money to eat. Why is the government shutting the jobs down?" So you can see, where are your priorities? That's where you have to start focusing on. So dealing with this virus goes much beyond just the medical aspects. We have to get the politicians involved. We have to get the economists involved. And we have to have, as I said, a global response. If you're asking me as an individual, at least I'm an educator. So I'm going to educate people about the plight. And we have to do this as having one vision to deal with this one virus. And one portion that I can help you out with is to bring to the attention of educators, politicians, and medical people the importance and the vast tentacles that mental health spreads out to.
Thank you. Have we lost our moderators? I don't hear Mary Jo or Bob.
I'm here. I didn't realize my microphone was still off. I thought I turned it on. I was going to ask our other distinguished speakers if they would like to make a comment on that or add to these thoughts. Dr. Basaru, would you like to add to that? Dr. Guy, Professor Guy?
Let's say just we're really happy and really thankful because we've seen that what he was saying in his presentation, the PowerPoint presentation, is almost what I've said in my talk. So we are aligned in some figures. We are aligned with him. Thank you so much.
Thank you, sir.
And Dr. Basaru?
Yeah.
Would you like?
What is the question?
Oh, the question is if you have something that you'd like to add to the thoughts expressed today.
What I'm saying that we have to publish so many things both in our journal and daily international newspaper. The solution, the challenge, and solution. And if you have not found the solution, we also will look for the solution for this pandemic. Although I discovered that we learned that many people have started to get vaccine for pandemic, and we have to make a online learning, distance learning as a priority. This one also have taught us a lesson to let us know that distance learning or online learning is very good, so that education will not stop, because education is the bedrock of any nation in the world. So we have to work hard, and how our researcher and we have to work in partnership. Like my university now, we have many centers, we have many research centers. I would like to partner with everybody here. So that's all. Don't want our discussions to stop here. We have to move further for the future endeavor. So that is what my own observation. So that we can also, I've already sent my WhatsApp number on chat platform. I've exchanged with some of the professors guys. I'm still expecting from other professors like you and some other professors. So that I do, like Professor Julian Goja, I have to have his email address and phone number, so that we may exchange the idea and collaboration for further discussion. Because
Wonderful.
our discussion here is very limited.
Wonderful. Thank you very much. We can definitely can work. That is the under the umbrella of the Nobel institution, which based on the concept of the environmental peace all over the world. So that to do the best of the best work and to support the whole world in the different situation, that we can definitely, we have to work, we have to come all together and to find out all the solution, right? This is the solution, is the most important thing. We have to find the solution in technologically, in academically, in all the things, right? So we have all the strong people with our organization. So let's work together and make this planet just one planet, right? This is one planet without any borders. So this is my I think that the conclusion. An excellent presentation given by Professor Julian Gojer, and regarding there's a psychological effect internationally what is happening. That is really very true, because in India, in Africa, in South America, in Europe, everywhere, we are suffering for this pandemic period, right? For this thing, right? So we have to work all together.
I'd like to add one little thing to this, and from speaking from one of the more wealthy nations, we have a lot of vaccine available to us already, and everybody on the planet wants this vaccine, or the most people on this planet would like to get this vaccine now, and we have to be more fair in our distribution of this. I mean, that said, I've already received my vaccine. I mean, I'm not an idiot. When it came through, I got it. But if not for pure humanitarian reasons and fairness, for selfish reasons, people who are not vaccinated, people who do not have the access, can become the incubators for new strains. So please, we need to do this. We need to share. We need to be fair about this. This should not be a divide between the haves and the have-nots.
As Professor Bashiru said, this is about partnership. It's about partnership from top to bottom within the nation. It's partnership across borders, and it's a partnership across nations. And it needs a virus to make us put down our arms, and instead of throwing bullets at people, we pass vaccines across borders.
And
yeah,
I would like to invite our remaining participants to make statements as well.
now there is one question, very yo. So you are talking about the vaccine. That's wonderful, but the point is that there's because the population, there's all over the world. It's a huge population. So
Absolutely.
who are going to manufacture this
We need to
vaccine, and
do right. We need the
who is going to
manufacturing.
distribute? And also the political corruption, I'm very sorry to say, is
Oh yeah.
all over the world. So that
Yep.
it is unreachable, untouchable in
Yep.
some countries, right? So this very upsetting situation. So why not? We can also, apart, the vaccine is fine when it is coming. Apart from that, why not? We can think about the alternative technology. So that is all the time what is I am focusing on that. Also this virus control apparatus, as well as also to apply the medicine, like in the advanced homeopathy medicine,
Right.
so
Right.
that will also increase the immunity
Yep.
boost up medicine, because I know I'm very much familiar, and our group has a very special good doctor, Dr. Ashok Dhali. Dr. Dhali
Right.
is there. So why not get all the things, all the best of the best thing, right? And
Absolutely.
we can try to promote
Yeah.
on behalf of the Nobel Institution International. At least we can try, right? Whether we are able or not, we can
One
try.
of the right in the 20th century, one of the most noble things that I can think of that happened was Dr. Jonas Salk when he and the development of the polio vaccine. They opened
Right.
that up to everybody. He could have been the first medical billionaire, and he basically didn't become one. Uh, he opened this up and said this should be something that everybody should have access to. And I'm hoping that we see the same thing with the COVID vaccines.
The telephone numbers of the participants are available online?
No,
Yes.
the only at this point they're only available on. They're not available on the YouTube chat, but they are available up for the participants here.
So how do I find it?
They're in the chat.
In the chat. Okay.
Right.
For those of us who can chat. Right.
Mhm.
Okay.
I can provide a transcript later for the participants.
Yeah, so that you can send it to everybody, all the participants, so that we'll have the access
Yes.
and to talk, keep in touch with
Yes.
the other
Right.
participants. That
I
is
should
the
be.
idea.
I should get a chat as a co-host. I should be getting a copy of the chat. So, if not,
Yes.
an India will have that.
Hello, moderator.
Hello.
Hello, yes. I would like to make a suggestion. We can also have a group chat, group on WhatsApp, so that when anybody have an information, we can easily to pass it around.
Yeah,
Likewise,
it
me
is
now,
a
I
good
belong to
idea.
many organizations that we can organize a conference, seminar, publication. And I also have a World Accreditation Commission that partner with UNESCO and some other organization body. So for the quality assurance in higher education. As we know that quality assurance is very important. It's a bedrock of higher education in the world. So, and all of us, we are stakeholder for this particular quality assurance in higher education. That's an accreditation. So we welcome every one of us. We are learning fellow in our field. Likewise, my own field now, I'm a computer science and information communication technology. The same also apply to others. So we have to contribute to know what to do to move our world forward. That's what's most important. So
Yes.
I will suggest you also can do that. I know you are very good in that, or you are very creative. So you can create a group chat for us so that we can change idea, so that it will help us a lot. Because
Sure.
I see that this group.
Sure. And also there's a very, very important thing is that Dr. Basiru, as you are connected with a government level, so why not set that so that we can in Toronto, so this is my inventions, and also the other scientists here like Roger Hansell and the other scientists are there, Professor, as well. We are working in this particular project, and already we got some excellent result on that. So why not? So we can also produce some sample, the sample also that we can promote in the country, in Africa, in the different countries. So it might be possible, so that if we can also manufacture in the very cheaper economical rate, at least we can give the support inside the building. That's for sure. Right, Roger?
No problem. No problem. We can do
Roger,
that. Can do that.
you want to add something?
Yeah. So later, by the grace of God, after this meeting, let me and you chat on WhatsApp and discuss further. No problem.
Okay.
You have impressed me. You motivate me more. You're a good friend. That is very good.
Oh, so now we can see the another of our speaker.
Yes.
He is also a scientist and a social worker, and also involved with our institution, Dr. Joyce Missoy. So she's late, but no problem. So Joyce can, Dr. Joyce can give her presentation.
Good evening, ladies and gentlemen, esteemed members of this forum. Thank you very much, Professor Bob Ganguly, for introducing me. My apologies for coming a little bit late. I'm actually having a problem with the network on my side. I am based in Nairobi, Kenya, and I am having some network problems. So kindly allow me to probably please present at the end of the session as I try to balance the networks here. Thank you very much, Professor Ganguly.
Welcome.
I'm delighted to be here. Thank you.
Okay. Dr. Missouri, will you need to share the screen?
Actually, yes, I will need to share the screen when the right time comes. And unfortunately, I will not be, if once I'm presenting, I will not be able to use both the audio as well as the video. So I'll shut off the video as I present when the right time comes. Thank you, Dr. Reddy.
Thank you. So as Dr. Missouri prepares to present, I'm going to ask Dr. Goger's colleague, Alexander Korovo. I'm not quite sure how to pronounce that. If he would like to make a few comments as well.
I think it's a Korobov, right? Alexander?
Korobov, yes.
Korobov.
Alexander Korobov. Yep.
Yes. Mm-hmm.
My whole role is just helping out. I actually assisted Dr. Goger in gathering much of the research that was in that PowerPoint.
Wonderful.
My opinion is very similar to his. I think we need to work together in this, and working selfishly or individually won't get us anywhere. So this is a time where the world needs to come together and gather arms and defeat this virus.
Okay. Also, I wanted to introduce also the first is the Mrs. Kristen Johnson. She's also the part of our organization, and she is she's a management personality, and she works with the management and other strategies, and also the one of our moderator also that Christine is there, and we are also missing another moderator, Dr. Shima Aziz. She has a job interview today in United States, in Washington. She couldn't join, and another person that joined, that is one industrialist from India, Mr. Subhajit Ganguly. So can you say something, Subhajit, regarding if we go for the manufacture of the economical technology there? Already we are for the other technology with the virus control apparatus. So how you can support us? Your microphone is off.
Yes.
Yeah.
Yes. Thank you very much for giving me an opportunity to say something about the innovation what Professor Ganguly has done, and it can be easily manufactured in India. In Kolkata, there are
3 big factories where it can be manufactured more easily, more conveniently, and economically. So the technology, it's very simple, and the technology, it's a proven technology, which it's immediately required at this pandemic situation to control the COVID-19, which is bringing everybody's life to a danger. So it is the right time if this technology gets a boost up from different organizations or from the different investor. So immediately we can go into the manufacturing process, because as already we are in this pipeline of manufacturing these different technologies, and the technologies which have been used since long time in India and also in abroad for controlling the toxic gases which are coming from the tailpipe of the exhaust cycle. And that technology is also a proven technology which has been used by the multinational companies in India, and also it gets exported to different parts of the world. That technology is already there, and the recent technology is what he has already invented, and which is also a proven technology for controlling the COVID-19, not only the COVID-19, the most that virus, also it controls, I think, more than 150 more toxic viruses, I think, that machine can control. So I have got all the infrastructure to manufacture that equipment easily in India, in Kolkata. Okay.
Thank you. Thank you very much.
Thank you very much.
Thank you very much for your support. So we will keep in touch with you in order to do the economical. We have to make it economical so that people can afford. This is the most important thing. We have to keep in mind.
And that can be taken, care. That won't be a problem for me to maintain.
Thank you.
Thank you very much.
Thank you very much. Okay. Roger, do you want to say something, or?
And there's nothing again than what I've told before, that we have a great group of chats and group WhatsApp chats
group or the group
for benefit of all of us.
That's right.
Very
That's
important.
right. Very important.
I have many organizations and I have an idea I have to set for you. So we cannot be in isolation.
Great.
Please.
Because this is the right time. We have to do something to save the human mankind, because it is totally
exactly.
Definitely. It is totally in a stake, and this is the right time. We have to do something for the next generation, and also for the generation what we have at present. So regarding the manufacturing and taking care for at a nominal price, it can be taken care. That is not a problem for me, because I have got all the equipments, and the technology can be easily implemented, can be manufactured in India, in our factory. Okay. Thank you very much.
You're welcome.
Thank you, Subhajit. So that Roger, Professor Hansell, do you want to add something?
So I have a question. Can the technology be exported to Africa? Is that a possibility? So it goes back to Subhajit, I guess.
Yes, it can be exported. That is not a problem. It can be exported.
Can create companies in Africa that develop the economies.
Yes.
There.
Because my company has already got the ISO standard, so there won't be any problem for exporting this equipment, and it will be going through the Chamber of Commerce, so there won't be any problem.
Retreat.
Thank you very much, Subhajit, for all of your information. So we will keep in touch, and the professors are there, Professor Basiru, and the other professors are there, so that we will keep in touch, and they are all well connected with the government, and also the
Great.
Professor Masui, Professor Joyce is also there. So we
Great.
have to work all together. This is the main
Right,
idea.
right.
This is the main
Right.
idea. Yes.
Yeah. Very well, very well. We have to work together.
Thank you
Yes,
very much.
because one day we go, one day we are losing, we are going back 10 years. It should be in our mind now. So this is the right time. We have to jump into it, and we have to get it done immediately, so that we can start giving a total presentation and everything, and immediately we can go for production. And regarding the production, regarding the cost effectiveness, you need not worry. That can be taken care of.
Thank you very
Thank
much.
you very much.
Thank you. Okay, so that I believe that our last speaker is the Dr. Joyce Missouri. Dr. Missouri, hello. Hello, Dr. Missouri.
Yes.
Hello.
Dr.
Okay.
Okay.
Hello. Can you hear me?
Hello.
Yes.
Yes, yes.
Okay, great. So mine.
Dr. Miss Joyce? Dr. Joyce?
Yes.
You are from what country, please? From what country?
From Kenya, Nairobi, Kenya.
Kenya. Oh, okay. You're welcome. You're welcome.
Okay.
East Africa. You're welcome.
I would like to just give a little bit more of an introduction to her before she starts. She's from the Earth Rights Institute. She's been quite the leader in the empowerment of African peoples in Eastern Africa, and she's currently promoting Africa's emerging markets and health and renewable energy, technology, innovations, and working for wildlife. So with that, I'm turning it over to Dr. Missouri.
Thank you very much, Dr. Reddy, for
Dr.
Thank you for that introduction.
Okay.
Well pronounced, Dr. Reddy. Missouri, correct. Thank you. Well, it's a pity that we are convening here today to discuss a pandemic that has really cost a lot of lives, and it's unfortunate that I think the whole world has been caught unawares, and a lot of our healthcare systems have really been exposed. So today I just want to, go do an overview of a few things that has really touched on the citizens of Kenya. And I'm sure this is the same right across the world. In Kenya, our first news on the outbreak happened on March the 13th. And quickly, the government went into top gear to be able to put some measures in place to make sure that citizens are safeguarded against the pandemic. And a lot of policies was a really a tight balancing act because whatever action or measure the government took really had an impact on the other side, especially in the business sector. So the government had to institute lockdowns, and that meant really affecting a lot of businesses, which meant downsizing and cutting down or total closures for a lot of companies. And that, of course, meant a reduction in income in most citizens. We also are looking at the health impact on the children and the elderly, as well as the women. The most important thing being access and affordability of quality healthcare. And within that space, right now we are experiencing a very increased rate of gender-based violence. And it's really a very unfortunate situation. When it comes to transport and tourism and entertainment, there's a lot of rising costs, bans on inbound airlines coming in and visitors coming in. Kenya relies a lot on tourism, and unfortunately, this is an area that has really dealt a blow the country. Last but not least is the education. Due to the school closures, a lot of communities that are marginalized have really suffered a lot due to the digital divide that we do have. And in terms of agriculture, which is the mainstay and a pillar to any ecosystem, you would have thought maybe it's only the urban areas that would have actually been more affected. But the rural areas have really been dealt a blow because the demand for agricultural produce has really gone down due to the fact that that there is no revenue, and therefore most people are not spending. And a lot of people have actually relocated back to rural areas in terms of cutting down their costs. So without so much going over, I think we all are very much aware about the symptoms of COVID. It is a very standard information right now. And in Kenya, the government and institutions such as AMREF have really worked very closely to make sure that communities get the right information, and every citizen is made aware of what they are supposed to do in the event that they experience these symptoms. Of course, government measures included border closures between counties. In Kenya, we have about 47 counties, and all of them were not really affected, but there have been a few that have been singled out every time the president puts out its or reviews the curfew. The hotspots, which includes Nairobi and 4 other counties, have been noted to really have spikes over the period. We have night curfews, which started at the beginning of last year. It started from between 10 p.m. to 10 a.m. and then it went to 8 p.m. to 4 a.m. That is where we are right now, and the president is not relenting on that. He wants to make sure that everyone is safe. Of course, there was closures in schools, but they have been reopened, and they are on with health protocols in place. In the process of all this, our creative young people have taken on the responsibility of creating awareness through art. And as you can see, the murals, especially in the slum areas, is what a lot of people really celebrating the young people for participating in making a difference towards curbing the pandemic. In terms of community, in terms of health, the government, with the particular focus on community health services in Kenya, dealing with the frontline health workers, has been very active in ensuring that the population's healthcare is access, affordable, and quality healthcare. And the government, of course, is very concerned and make sure that the safety of the healthcare workers are taken care of in terms of their psychological support due to isolation and long-term hours at work, and also very stressful conditions sometimes. So the government ensures that the community health workers are taken care of. Of course, at the outbreak of the pandemic, most Kenyans stayed away from hospitals initially because of fear of being quarantined, and that's exactly what was happening. So very few Kenyans, the whole of 2020, were very skeptical in going to hospital for their treatments. And according to our Kenya Bureau of Standards, we do understand that most Kenyans do have pre-existing conditions, which really exacerbates the COVID-19 situation, and that I think explains why. In terms of transport, the curfews has really also had a big impact. The curfews that are really, Kenya is known for traffic jams, naturally. But with curfews, this has really given it a different dimension to it. The transport costs have gone up, and as you can see, a lot of people have resorted to walking or probably taking motorbikes, which has really now gained traction due to the fact that they can maneuver through the traffic, as well as the ferries and at our coast areas. So transport and curfews has really also had an impact on citizens in terms of actually leaving some of them stranded, because when you try to rush to beat the jam, you end up not getting those public vehicles coming back on time. Of course, COVID has also disrupted our traditions, cultures, and entertainment. In Kenya, we usually have a livestock market that are now closed down. It's usually celebrated in rural areas, and it also gives some revenue-generating initiatives to rural folks. Ceremonies, celebrations have been toned down, and I think right now we are at a minimum of about 50 people that can attend any event, weddings and funerals alike, as well as religious gatherings. Right now, we are not allowed to go to church, and if you do, make sure we do it at a minimum. The manufacturing sector as well has been dealt a blow. The lockdowns have really pushed closures of industries, and there's been massive layoffs. And like I said, this is a tight balancing act by the government to flatten the curve, which has really resulted in disrupting the manufacturing sector. And hopefully things will change soon. And according to the Kenya Bureau of Standards, most absences were actually due to lockdowns and or stayaways due to instructions by the government or the employers. And most of them are not aware as to when they should actually go back to work. But some of them have just gone ahead and reinvented something for survival while waiting for their time to go back to work. Most companies have also resorted to online operations. In terms of education, now schools are reopening with new protocols in place. For some students, there's an option of having online distance and homeschooling. And unfortunately, for the marginalized communities, they'll suffer the most because of the digital divide. And unfortunately, only the privileged can be able to actually access education in this manner. Tourism, as we say, the hospitality industry has been affected the most due to bans of inbound airlines and arrivals from several countries, as well as entertainment. But like I said, this is a moving target. About 2 weeks ago, we officially had our Minister of Tourism actually welcoming several airlines from different countries to come to Kenya. So I like to call it a moving target. In terms of coping, it is quite a challenge, really, for the informal sector. On your right, you see those two ladies sitting there. That is a setup in one of the slums. Kenya has one of the biggest slums in Africa. And, you know, when you talk about social distancing, it's really, you say it with a tongue in your cheek, because how do you expect people who live within a small space of that nature to actually conduct social distancing? And so there are few volunteers who have actually been assigned by UNICEF, by the UN, and other NGOs to actually work closely with the inhabitants of slum environments to be able to at least observe within their abilities the requirements of COVID-19 measures. And the photograph in the middle, I post this here because this has actually called for many people to redefine how they do business. It is possible that the person we see here was laid off. This was somebody who had a good job, but has resorted to actually having to sell goods, but not in the normal way as we are used to. At the picture at the bottom on your left, she has decided to utilize her vehicle to actually, you know, she has made it a shop, you know, a temporary shop, let's call it that way, a grocery shop out of her vehicle. So a lot of people have had to be very creative in terms of actually surviving. In terms of food security, this, like I said, has been felt right across both urban and rural areas. And the rural areas is because the demand for agricultural products has actually reduced, both locally as well as for exports. And again, this is due to closures of industries and massive layoffs in urban areas. So the global reduction in remittances also has been felt by the rural communities. And while the migrants from the cities overwhelm the rural public services due to influx, you know, the jury is still out. And I think this is an opportunity to do a lot of research now into these scenarios that are unfolding before us. Last but not least, of course, the farmers, you know, pillars and the mainstay of our livelihoods, the small-scale farmers. The COVID, as it intensifies the already severe impacts of the climate crisis, and in Kenya, for example, we had locusts and droughts. We feel that the farmer is really feeling the pinch at the moment. And there's a research that was done by Microsave. The farmers are feeling the pinch whereby they cannot actually pay suppliers in time due to the fact that they cannot receive their revenues on time. There's also the fact that paying rent, of course, is not an issue for them because there's people who are living on farms. But when it comes to paying wages, that is also a big concern for our farmers, as well as paying back the loans that they owe in terms of their input to their farms. And with that brief presentation there, I want to thank you, Dr. Reddy, for giving me this opportunity to share with you.
Thank you very much, Dr. Joyce,
Thank you
for your participation and your excellent presentation.
Thank you, Professor Ganguly. Thank you, Dr. Reddy, for the opportunity.
You're welcome.
Thank you. I do have one question that's kind of unrelated. I've been working with wildlife in Africa, and I was wondering how the pandemic may have impacted that activity. And the preservation of some of Africa's wonderful fauna?
Actually, I think, except for the fact that the tourism visitors population has gone down, that ecosystem remains intact. I was actually there yesterday. I am trying to work closely to actually renovate the orphanage at Nairobi Orphanage with the directors there. So everything is intact and all is well at the Kenya Wildlife Services of Kenya. Thank you for asking.
Thank you.
So, yeah.
So, if there's any, would anybody like to make any further statements or comments on any of the, or questions for any of the speakers?
I have a question. Which other organisms besides humans are impacted by COVID-19? Does anyone have a sense? I think some dogs are.
I've heard dogs, I've heard some cats, and some of the zoos have had cases. Minks have made the news with the slaughter of minks in Denmark, the Netherlands, and I believe Spain had an outbreak among the minks. Bats have been implicated as one of the potential reservoirs, and at least in the early reports, one of the initial theories of how it entered the humans was from a bat through a pangolin, who acted as an amplifying vector, and then into the human population. But I think that's still pretty speculative. It seems like the ACE receptor that the virus needs is pretty widespread through the mammals. The mink problem was particularly disturbing up in Denmark because they estimate that based upon the number of mink that escape every year, there may have been up to 100 infected mink that got loose before they were able to kill off the population of potential infected animals. So if so, that means it could spread from there to other species, and we could have a real problem, or an additional real problem. And that's the good news for today.
Thank you.
I'm silenced.
I'm sure there's other species too. Those are the only ones that I've heard of so far. I know there was an initial fear early on, but I think it was finally ascribed to something else, that there were some elephants getting sick somewhere in Africa about the time that COVID was hitting. But I don't think that was ascribed to COVID in the end.
So I believe so now that we can conclude our this webinar. Mary Jo?
Yes, I want to say thank you to all the speakers today. Dr. Guy, Dr. Bachile, Dr. Misowi, and Dr. Goja for their presentations, and the others for their comments and additions that they've made. And I'm hoping that people will be able to join us in about roughly a month, maybe a little less. Date is to be announced, probably on hopefully a Saturday next excuse me, next time for our focus on the Indian subcontinent. So thank everybody very much. And I'm terrible at goodbyes. So
Thanks, Lorenzo, for setting it up. Yes.
thank everyone.
Thank you.
Thank you, Mary.
Thank you very much for giving the African
Africa
opportunity to
seemed like it
share
should
our,
come first. So
observations. So
Africa is so often overlooked. I thought Africa, I think we all thought Africa should come first.
Yes.
thank you. We are humbled for that opportunity. Thank you very much.
Thank you.
And, we've
Thank
learned
you
quite
very
a bit.